Today we can discuss about intrauterine growth retardation. You can also called as a small for date and also called as a chronic placental insufficient. What are the definition and causes and clinical manifestation? What are the types of and how the management can done in the intrauterine growth? We can discuss. First, we can discuss about the definition. Babies whose birth weight is less below the 10th percentile of the average for the gestational age. The baby's weight is 10th percent. The baby's weight is below the 10th percentile of the average of a gestational. There is no in the gestational age. There is a difference in gestational age, but the baby's weight will be 10th percentile is below the 10th percentile of the average. Next one is a cause. There is a cause of there are three: maternal factor, placental factor, and a fetal factor. What are the factor in the maternal is a malnutrition, anemia, alcohol, smoking, substance abuse, and toxemia of a pregnancy, and the gestational hypertension. What is the toxemia of pregnancy? And the mother having a hypertension in the gestational age. Old mother, the mother having 40 years above, the mother affected in the intrauterine growth retardation. And the placental factor, placental previa and placental abruption. We can see in the we can discuss in the last video placental previa and placental abruption. And the fetal function, the natal or a chromosomal abnormality. Next one is the types of intrauterine growth retardation. What are the intrauterine growth retardation? The symmetric and asymmetric. You can see in the pic. Symmetric. First we can discuss about a symmetric, or also called a hypoplastic small for a date. It is only for 20%. Generally the proportional reduction in the size of all structure and organ. The size of all the structure and organ can be affected, and reduction in this condition. The fetus affected very early because of the multiplication. Cell division can occur in the early phase. It is also cellular hypoplasia. Next one is a asymmetric. Asymmetric is a effect we can see in the many child. It is a 80% disproportional reduction in a size and of a structure. Disproportional of a child and structure. The fetus affected in a later month during the phase of cellular hypoplasia. It can occur in only one part of the body. Will be reduction in the increasing the height of the head of the babies is larger than the body. One is a Pontal index. Pontal index is an important index for the measuring the. It is used for asymmetric and asymmetric intrauterine growth retardation. We can conclude that in this index. Pontal index is the weight in a gram and length in a centimeter cube and into 100. The less than 2 is the asymmetric and more than 2 is a symmetric. Next one is the physical features at a birth. What are the features at a birth? The defect birth weight. It is most common in the intrauterine growth. The defect in the birth weight in the length will be unaffected. The appropriate thermoregulation. The thermoregulation is the temperature will be appropriate. It may be hypothermia and it may be hyperthermia. The head circumference larger than the body. It is main physical feature in the intrauterine growth retardation is a head circumference larger than the body, and a sign of a polycythemia is high, and the more production for RBC by the bone marrow and a cyanosis. We can see in the jaundice also. We can see in the intrauterine growth retardation. During a pregnancy, what are the future can be seen? The abnormal fetal growth usually note in the during a pregnancy. What are the future can in the intrauterine growth are the abnormal fetal growth usually not during a second trimester. The abnormal fetal growth we can see in the second trimester. Fundal height is a less than the expected for the number of a gestational week. The fundal height is less of how the number of a gestational week is increases. The fundal height will be less. What are the management? The administration of betamethasone 2 dose at a 18-hour interval of a lung maturation. You can give in the betamethasone. You can give in the baby Best to perform episiotomy to prevent a intracranial birth injury. This is one of the procedure is important in the during a delivery. Episiotomy can be done to prevent a intracranial birth injury. We can see in the pic, and prevent hypothermia. The management we can nurse should know the prevent hypothermia. Advice to admit at a secondary level newborn unit and weight is 150 to 180 gram. Territory level newborn unit of if a weight is less than 150 gram, you should the baby can shift into the territory level. If the baby's weight is less than 150 gram, the treat at a home if a birth weight is more than 1800 gram. We can treat at the home. The birth weight is 800 gram. These are the management in the intrauterine growth retardation born of the baby. Thank you.